So a 20-year-old man is brought after a car crash. An exam shows hematoma above the right ear and was unconscious initially, but returns to normal baseline and neurological exam is normal. CT shows fracture on the right pterion and over the next few hours starts becoming confused and has weakness on the left arm and left leg. Eye exam also shows right pupil is dilated and unresponsive when light is shown. What is the mechanism of injury? A. Subdural hematoma, B. Subarachnoid hemorrhage, C. Epidural hematoma, and D is cerebellar hemorrhage. So I'll let you answer the question and then I'll explain in 5 seconds. Okay, so the answer is going to be C. Epidural hematoma. So for this question, the epidural hematoma is caused by a trauma. In this case, it's going to be the car crash. So what happens is the middle meningeal artery runs near the pterion of the skull. So there's a fracture there, and that's going to cut the middle meningeal artery, leading to an epidural hematoma. Now for this, there's 3 parts of the meninges, which are the things that cover the brain. And so it's going to consist of the dura, arachnoid, and pia layers. And so this is just going to be above it. So epi is above the dura, so it's going to be above here. So that's how you get this bleeding. And so what happens to cause the presentation is the herniation of the temporal uncus. So essentially this herniation of the temporal lobe compresses the cranial nerve 3, which is the oculomotor nerve. And so the oculomotor nerve is typically responsible for constriction of the pupil. So if you have a compression of this nerve, it's going to impair it, and therefore it's going to cause the dilation of the pupil. So if this is parasympathetic, and so this causes a constriction. So if this is impaired, then the only thing that can happen is dilation. And so the other part is the weakness on the left side. So the herniation is also going to compress the midbrain, and that's going to impair the upper motor neurons. And for this case, it's going to be the upper motor neurons on the right side of the midbrain. Remember, in the brain, everything's a little bit contralateral. So on the right side, if the right midbrain gets crushed, then it's going to impact the left side of the body. And that's how you get the clinical picture of the right eye being dilated, because the temporal lobe is compressing the oculomotor that's right there and causing dilation. And then also compressing the midbrain, which is going to cause contralateral, so in this case, the left-sided weakness in the arm and leg. So next, it's going to be a subdural hematoma. That's the other answer choice. So in this case, it's going to be tearing of the bridging veins. And so when you get this tearing, that's ends up being below the dura, right? So subdural hematoma. And for this one, it's most common in the elderly, and then anticoagulation also. If the patient's on anticoagulation, and a lot of elderly patients are, then this can cause this subdural hematoma. Next, we have cerebellar hemorrhage. So the cerebellum is the only one that has same-sided effects. So for example, if you have a hemorrhage in one side, for example the right side, you're going to get limb ataxia on the same side. So in this case, you would get limb ataxia of the right arm and leg if it was affected on the right side. So if you have limb ataxia, that's going to cause some unwanted movements, and that's going to impair walking. And so their gait exam for their neurological exam would be abnormal. Next, we would have slurred speech. And so this patient in this problem stem did not have any of this, so it wouldn't be cerebellar hemorrhage. Finally, we have subarachnoid hemorrhage. So typically these patients have a severe headache, and the buzzword is thunderclap headache. So the worst headache of their life would typically clue you into a subarachnoid hemorrhage. However, you might see other signs like neck stiffness, or if you flex the neck and the patient gets pain, that can also indicate if the patient's unable to verbally tell you. finally, we have photophobia, which just means that they have pain when they see light. So in this case, once again, the patient isn't complaining of these things, and so we go with our answer of epidural hematoma. And just to review, for this case, you essentially needed to recognize the classic presentation of epidural hematoma, which is after a trauma incident. And usually what happens is the patient is knocked unconscious and they return to consciousness and they look completely normal. And that's called a lucid interval. And then they start having problems again. And so, for example, in this patient, we had the confusion and we had the weakness on the left arm and left leg, and then we also have the dilation of the right pupil. So that's how all these things lead you to the diagnosis of epidural hematoma. So I hope that helped, and thanks for watching.